Greetings, welcome to the Diabetes Educator podcast. On this podcast, we will offer standard and recommended practice of not only managing your diabetes goal, but how you can get involved in advocating for proper access to healthcare and bringing opportunities within the diabetes online community. It's Tino, a patient advocate and a certified diabetes educator.
I'm Hona. I'm a recently graduated medical doctor. Together, we want to raise awareness, open a discussion about diabetes, share ideas, thoughts, different perspectives, and overall create a safe environment for everyone who needs to express his or her thoughts.
We'll be hosting a series of podcast episodes from people living with diabetes, caregivers, healthcare providers, researchers, and we encourage you to get involved, get engaged, and come up together to create the change that we need. Welcome to the Diabetic Mogul. Advocate Erum, introduce yourself so that the audience knows who you are.
First, I would like to thank you for inviting me. Really honored to be here. My name is Erum. I am from Pakistan and I'm working with the Bukai Institute of Diabetology as a senior consultant diabetes educator. I'm also working with IDF. I'm lucky to get introduced with Dinoware from the WHO. So this is how I'm working. And I'm working with many associations. Right now, I'm serving as a president of National Association of Diabetes Educators of Pakistan.
Thank you so much for the brief introduction. Yeah, it's an honor to have you with the subject that we are going to be covering today, which is Ramadan. So maybe the first question that I'd have to ask you is, because I think everybody, even if you're not a Muslim, we know about Ramadan. So you share with us briefly why it is very important for every Muslim to observe Ramadan.
I think every person should know about it because you have friends, you have society. Every society have different people with different religion. That is very good question that why it is so important to fast as being a Muslim. The religion of Islam has 5 pillars. It is standing on 5 pillars. And the one pillar is fasting. I can't complete my religion without fasting. This is how it is. So that's why it is very important to fast if the person is Muslim.
We have friends living with diabetes, and even yourself, you do fast. Is there criteria for you, for people like you who are living with chronic illness like diabetes?
Yes, very important to understand that Islam or being Muslim is not something which is getting posed on anybody. Like anything, fasting is not imposing on us. We have to do that. But if we have a condition like diabetes, or the person has compromised kidneys, they are on dialysis, some sort of stroke, or any condition, severe condition, that people doesn't have to fast. And there are many other ways to fulfill that criteria. There are some, if the person is healthy, if we only talking about people with diabetes right now. So if the person is healthy, if the diabetes is in control, and if they don't have any complication, then they are obliged to fast. Otherwise, they don't need to fast, and we have exemption for.
I think that is a brilliant answer. So thank you so much, because I thought maybe it's just to say, hey, everybody has to do this, regardless of their condition. You're also involved in preparing people, like people living with diabetes who might also have to fast. Like, what are some of the challenges that you face?
The main challenges the people with diabetes usually face at the beginning of the Ramadan. Because, when they start fasting, the patterns get set. But the first thing which they face, that most of the time we face cases, or I'm working with a tertiary diabetes care center, so we do have hospital admissions, running OPDs. So people come to us with a complaint of hypoglycemia, and especially that happens in middle of the day. So people come to us with cases of hypoglycemia, or maybe some people present with hyperglycemia. There are many people who need to know that if you want to fast with diabetes, this is very, very important that you should have medical assessment before Ramadan. This is a very important point, which usually people miss, that you should have pre-Ramzan consultation. You should ask your doctor to run all the tests. And if he will give you a go that yes, you are fit to fast, then fast. Otherwise, people may face any complication, an acute complication like hypoglycemia, severe hypoglycemia, hyperglycemia due to the alteration of meal, type of meals. I'm really sorry to say that many people do feast rather than fast. They eat a lot. So this is the month of fasting, not feasting, that we need to consult our doctor. We need to take advice. We need to check all the possible complications. And we need to understand that how our meals will be altered and how our activity will be altered. So we're good to go.
Good to go for sure. Thank you so much. We have Muslims all over the world. It's steadily increasing, right? We have so many people from these Muslim communities that are living with diabetes. We might also have people in Zimbabwe who are also Muslims living with diabetes. We need to know, we're interested, what kind of support that you give to people in Pakistan who are living with diabetes during the pre-Ramadan in terms of exercise, the things that they should do, the things they should be watchful for those that you say these ones can really fast?
I can simplify that question, that what are the tips to have healthy fasting with Ramadan? We need to emphasize on three things majorly. The first thing is the meals. The second thing is your physical activity, medication, the alteration of insulin, or maybe if you are not a person with type 2, not a person with type 1 diabetes, then maybe your oral hypoglycemic agents or the tablet. Let me explain the meals. Usually, people with diabetes take 3 meals, major meals, and 3 snacks if they need. They distribute their whole intake in 6 times. This is the normal pattern. But when we fast, then we have to take 1 meal at time of dawn and 1 meal at time of iftar, that is the sunset. Technically, they take 2 meals. Between the time between sunset and sunrise, they usually sleeps, or maybe some people get up and eat something, or maybe they doesn't sleep. But the meal timings get altered. So it is my advice to take healthy meals. Usually people, if you go to the Gulf, if you come in the Asia, you'll see that the fried item get increased in their meals, which ultimately affect on their glycemia because the fat contents get increased. We need to understand that as much as healthy we will eat, we will remain in good health. Either that is Ramadan or either that is the normal days. So they should stick with the healthy items. Of course, once in a blue moon, they can eat anything. We can't stop anyone to take anything. But yes, once in a blue moon, they are allowed to eat whatever they want, but not on the daily basis. And even in that time, they need to know that how to balance their insulin with that meal. The second thing is that they have to take insulin before breaking fast at the time of iftar. I want to clear one thing. Many people think that their fast will be broken by checking blood glucose levels, or fast will be ruined if they take insulin between the fasts. So let me clear by this opportunity that this is a big myth. Your fat doesn't get harmed with taking insulin or checking your blood glucose level. The God has instructed us to fast, but he hasn't instructed to do a suicide. Because if we people with diabetes doesn't check our blood glucose level, we don't take insulin, that means we are trying to kill ourselves. So we need to understand that fasting has no such thing. And the second thing, which is I was talking about, that is physical activity. I must explain and I must recommend that don't do any exercise or extra work during the fasting time, because that may give you unintentional or maybe unexpected hypo. So don't do it. If you want to do your regular exercise, do after iftar and do after the post sunset meal. If you are saying the prayers, we have a special prayers during Ramadan that is called Taraweeh, that are said after the breaking fast. In evening, if the person is observing those prayers, then they are equal to exercise. So you don't need to do any exercise while fasting if you are observing those prayers. And the last thing, medication. You must learn that how to balance your medication with your meals, with your daily routine, with your physical activity. And you can do it by the help of your doctor, by help of your diabetes educator, by help of your diabetes care team. If you give importance to all these factors, then I can assure you then you can fast with diabetes very healthy way.
They should look at you because you're also healthy. You're also practicing Ramadan. You observe it. Wow, thank you so much, even for helping other people, supporting other people that needs to do this so that they understand that even some people can be exempted from fasting. People, we usually speak of stigma because some people do not understand really what diabetes is, what it comes with. How do people with diabetes deal with this kind of stigma, especially when they are being exempted from fasting? What would people say to them? How do they deal with that?
My dear friend, I think it is now very much sorted out. Now people understand that these people are exempted. For example, if the lady is pregnant with full term, if the person has diabetes, severe hypos, patient with the CKD or person with the CKD, and if they have any recent big surgery or if the person is on dialysis, these kind of people are exempted. But I am very glad to share that with you. Now, stigma is very much sorted out due to awareness, due to education. But yes, it was there. Like if we go back 10 or 15 years before that time, then it was a great stigma. Oh, you are not fasting. Oh, I'm so sorry. People used to do that, but now people are aware that some people are exempted and they can't fast. I'm glad that now people help each other. I myself, I have faced many time the situation, and I like that very much. That somebody has said, I think you should take a break. You are fasting. You are a person with diabetes, so I think you should take a break. You should take a rest. So people help you out. It is not a stigma anymore. Not even in Pakistan, at least. I'm happy that something is getting better.
So thank you even for your involvement in the drafting of the guidelines that we need, because I think they were firstly drafted in 2016. A huge thanks to the IDF for the way that they're doing, because they're taking this is a very serious subject, because so many people are living with diabetes who belong to these Muslim communities, and they're going to do it. It's not like saying everybody is going to come to seek for help, to seek for support. People assume to say, hey, we know everything. So what would you say to people who do fasting contrary to the medical advices, who do like against?
Well, I would say majority of people with diabetes, first of all, must explain to your health that any kind of, or I would say any type of people with diabetes can fast. Either they are type 1 or either they are type 2, because most of the time people thinks that type 2 diabetes obliged to fast, but people with type 1 diabetes are exempted. No, this is not like that. First thing which we need to understand that everyone with a good healthy life with a good control can fast. What I would advise, always take advice from your doctor, from your medical team. You are very much right that I even face some people here as my clients. I would not say as my patients, as my clients, that they fast despite of my advice that you shouldn't fast. This is very bad in a way that if we fast, why I'm going to stop? I'm your well wisher. I'm your healthcare provider. If I am stopping you, if I am telling you that you shouldn't fast, that means there are some risk in that. So always take advice of your medical doctor of your diabetes care team, because they are the people who are the best judge of your medical condition. And trust me, that has the full backup of religion. Because I used to be very afraid. I'm sharing this with you, that I used to be very afraid by stopping someone that no, you shouldn't fast. I used to think that God will say to me, who you are to stop anyone. So I took full advice from the experts of religion. They said, you are the person who are experts on the condition. It is your duty to aware people that fasting can be risky for you and you are allowed to do this. So it is my advice that always follow instructions, the suggestions of your healthcare providers, because they are your well-wishers and they want you to live a healthy life.
Bravo. Again, I think, and even the people that will listen to this, they'll be grateful to you for everything that you're sharing, the words of wisdom. If you could share with us the impact of fasting on your physical and your mental health.
That is very nice question, because I think if diabetes has a second name, then I would say that is schedule. Because if your life is scheduled, going to have control on your diabetes. So during the Ramadan, we get more scheduled. We have a very scheduled life because we need to pray at certain times, we need breakfast at certain time. It gives a very good impact on our physical and mental health, because we get connected with the religion more. The spiritual factor is giving us more mental peace. So technically, our physical and mental health get improved while fasting as compared to other days.
Pretty much everything that I wanted about the impact of fasting itself, maybe on you, because you're also somebody who fasts, not just an advisor. Because I think it's pretty much difficult if you are not a person living with diabetes, but you're also advising people to do fasting. People usually say there's nothing about us without us. It should be the people living with diabetes who are involved in the planning of our education. They're not just speaking from their expert opinion, but from their lived experience. They would know so much. And I think it's priceless, really, to have people like you speaking about this. We learned that Ramadan itself does not only alter the meal plans for people living with diabetes. Everything is altered, like even the sleeping pattern. Sleeping is disturbed for people that do fasting during this Ramadan, because I know it stretches for a month. Usually doctors speak about this to say, hey, you need to have enough sleep, like every day. So what sort of recommendations that are available for people living with diabetes that are also observing Ramadan?
Well, definitely, you all are very much right that sleeping factor is very important in the self-management of Ramadan. But the main thing which we need to understand, that during Ramadan, definitely our sleeping patterns get disturbed, or maybe I would altered. So what we recommend, people with diabetes have a bit of nap during the Ramadan, and most of the time they do wake up for the morning prayers. We don't need to wake up whole the night. We need just to wake up for like 30 minutes before the morning prayers. Technically, there is not much alteration in sleep patterns. And if you go for the scientific evidences, you will see that most of the time people get their, I'm talking about the journal, people get strokes or maybe the heart attacks or something like that in the middle of the night. It is recommended that if somebody wake up for a minute or have a glass of water, get sleep, again, just a bit of waking up episode during the night, that can save such episodes. So technically, that is not harmful to wake up in middle of the night, but definitely I'm not saying the person should remain up from sunset to sunrise. No, I am just saying that they need to take their sleeps and they need to wake up for like 1 hour between that, and that is perfectly fine. There is no harmful effect of that alteration on diabetes. There is nothing like that, that it will harm or it will ruin the control of their diabetes. If somebody thinks like that, that is totally wrong assumption. and wrong statement.
I know kind of so many adjustments that people need to take during this period because it involves a lot. What kind of adjustments do people need to take in this criteria? Because I know as people living with diabetes, we are often told that diabetes is individualized, we shouldn't skip meals, and so many other things. The list is endless. So what kind of adjustments that are necessary for people who do fasting?
The first thing which is important, if we are on insulin, then we need to adjust our insulin according to our intake. This is the thumb rule for even without Ramadan, that we need to balance the insulin with our meal. But during Ramadan, what we do, how we practice in Pakistan, and it is very successful in many ways. I even have done a study last year that is in writing phase. One study is published that how I alter insulin for people with diabetes and how they remain in safe zone. We usually move morning dose at time of iftar, means at time of evening meal when they break the fast. We reduce 10% of their insulin, short acting insulin, around 25% of their long acting insulin, or maybe intermediate acting insulin. This is what I'm telling you, the morning dose shifted to a time of iftar, evening dose, because that is the big meal when the people break their fast. So technically that covers from sunset to sunrise. We shift the nighttime dose or the dose, pre-dinner dose, at time of sahur, means in the morning before the sunrise. We reduce that to 50%. This is how we start insulin. We alter insulin at the start of Ramadan, and then we build up to the dose according to their SMBGs, according to their blood glucose level. Because what is our first priority? That they shouldn't have any hypo during the Ramadan, because hypo is a scary thing for many people. I myself is a fan of mild hypo, because I think if you cross the normal, then you will have a mild hypo. So that means you are normal. Your blood sugars are normal. You should be happy about it if you are having a mild hypo. But people get very scared. We need to save them from hypo, so we give them a safe dose and build up that dose. Then Ramzan proceeds, and after observing their SMDGs, their blood glucose patterns and the trends. But the main the thumb rule is the morning dose shifted to iftar pre-sunset, and at the time of pre-sunset, the dinner dose at the evening dose shifted to morning pre-sunrise dose. This is how we do alteration in medication.
Thank you for speaking like a pro. The Diabetic Mogul podcast
And the last thing which I would like to say, diabetes is not something which is going to stop you from anything. I'm just talking about the society. People says that you are not normal. And I always says that yes, I am not normal, I am exceptional. So please remember that you are exceptional and you can do anything. This is not your weakness. This is your strength. I am the example in front of you. I am working with many international bodies. I am very known face in my country, and that all happens because of diabetes. Diabetes is blessing for me. So I am not very special person. You can do that same. You can fast with it. You can have happy life with it. You can have a normal life with partner, with children, with a good future. Just hang on and never lose your hope. Thank you.
Thank you so much for joining the Diabetic Mogul podcast with your expert opinion, your advice during this Ramadan. People don't take role. Hey, I'll be busy, but thank you so much for giving us a time so that you could cover this topic. You were there for us. So thank you so much. Much preparation is needed if you know what you need to do. And so, hey,
Yes.
everybody listening, people living with diabetes who wants to do Ramadan, yes, do follow the medical advices from the medical health professionals. That is crucial. So that's what we learned. from our advocate,
Yes.
Erum. Thank you so much.